my name is Claudia Hales and this is little Gussie Hales, and today I'll be taking you through a physiotherapy plan I've developed especially for little Gussie, who is a 12-year-old desexed male toy poodle who is recovering from surgery on his left hind cranial-cruciate ligament. Gussie is owned by Saul and Jessie Craig, who are both professionals living in a single fronted house with a small backyard. Gussie does not have any other current health issues to be concerned with at this stage. Okay, and today, so part of the physical therapy plan, I like to start with some ice cold ice block therapy that we place on the affected area. Make sure that it is covered in a tea towel or a towel just to protect the skin from frostbite or burning. We will leave this on the affected area for 10 to 15 minutes at a time, but making sure, as I said, you stop every 3 to 5 minutes, making sure that the skin is coping okay. Now I'm going to take you through what's called passive range of motion exercises and massage. So generally what I like to do is start with a massage. What this does is it helps release the tension in the muscles and helps promote blood circulation also. So what I get you to do is, it's good because Gus is nice and light, so I can actually just hold him in my arms, but just with your fingers, just gently massage just around, and you can feel all the muscles, and just very gently all the way down his leg and even just down into his paw. So now I'll be taking you through some flexations and extensions of the limb, which is a part of the passive range of motion. So what we will be doing now is a left hind limb flexion. So I'm grabbing his hind limb with my hand just below the stifle, which is the knee, and then the other hand below the hock. Might change hands there. And so basically what we're doing is bringing the stifle knee towards the body of Gus, while the hock, the ankle, is brought kind of to the ischium, which is the lower hip, with the metatarsals being pointed towards the tibia, which is accomplishing full flexation. So just that hind limb flexion in one kind of brief, quick movement for you, so you can kind of see. So basically it's just taking his little knee up and then back out again, stretching all those muscles, so just up and then back out again. Okay, so once you've done that 4 to 5 times with kind of a 10-second hold flexing out, which is stretching out the hamstring, we'll go into what's called a bicycle. So basically grabbing his back hind limb again and putting it up and literally making it go into a bicycle movement, which is helping all of the joints and the tissues get stronger and develop. Okay. Next we're going to try the hip flexion, which is a stifle extension. So basically it would be best if Gus was lying down, but unfortunately he's not today. But what we will do is grab his limb and we extend it all the way forward, if you can see that, and then hold that for 5 to 10 seconds. Okay, and then allow that back down again. Okay, and that's achieving a full stretch through his hamstring. Okay, next I'll go take you through some strengthening exercises for the muscles that you would probably start around day 10. So basically it involves low impact walks on lead. Make sure he's on a lead. So just take him outside into the yard, probably 3 to 5 times a day, or how often he needs to go out to toilet. Stop. Okay. Also, what we'd like you to do, please, is what's called a sit to stand. motions. So basically you have Gus sitting like this, kind of even in the Sphinx position. And then basically what we do is just give him some food or something and gently allow him up. So he's using his back legs and his bottom, and then we go back down again, and then we just repeat that. So he's using his own legs and strengthening up his muscles through. And with a sit to stand, what I do recommend is that it's done up to about 6 times, maybe a couple of times a day, just generally seeing how he's feeling about it. And once Gus's surgical wound has completely healed, around the 10-day mark, I recommend that you organise his hydrotherapy sessions that will help obviously increase his recovery. Well, thank you so much for that, Gussie. You've been great. Just a few little points I'd like to make before I go is just to make sure you remember to take it really slowly for the best results. And also do what you can. If you can't do the whole program, then that's okay. And always contact your veterinary clinic for support and advice, because we're here to help. Make sure also that you're keeping an eye on the day-to-day improvement of your dog. Making sure that he or she is not in any unnecessary pain or discomfort. If you see any swelling or significant redness appearing around the surgical site, it's best that you do take them back to the vet to get double checked. Also making sure that not to force their limbs into position, because that could actually cause further damage. So just allow them to kind of move into the motions with you, and once they're at the point of resistance, just hold that for up to 10 seconds and then release, and repeat that 4 to 5 times. And it is imperative, as I've already mentioned, to take it very slowly and gently, because they'll generally be quite stiff. They'll become quite stiff, throughout the night. So it's best to start this program kind of in the morning, starting with some light massage, and then following through the physiotherapy plan provided. Okay guys, that's it for today. Gus and I would like to say a big thank you and good luck with helping your dogs recover from cranial cruciate rupture repairs.